Good afternoon, everyone. Thank you for joining today. Today's briefing will start off with Mayor Tom Barrett. Next, we'll hear from County Executive David Crowley. Then Dr. Ben Weston, Director of Medical Services for the Office of Emergency Management. We are also joined by Darren Roush, Health Officer and Director for Greenfield Health Department. The City of South Milwaukee Mayor Eric Brooks, and Beth Weirick, CEO of Milwaukee Downtown Bid. Thank you all for being with me today. And we'll start things off with Mayor Tom Barrett.
Thank you very much, Catherine. And my assumption is that there will be a lot of questions today, or a lot of interest today in the situation in Milwaukee with the marches, the situation surrounding George Floyd's murder. I will be talking separately to the press following this later this afternoon. I'll be addressing those issues. At this time, I want to talk about some of the progress that we're making here in the city of Milwaukee on the COVID-19 crisis. We continue to work on keeping the spread of COVID-19 under control. We know that we are not anywhere close to being out of the woods, that this is a marathon, this is not a sprint. And to the extent, and I know that this is difficult to say right now with all the unrest that we're seeing, that we are still in this together, and we'll get through this together. And I want our city and our county to be a safe place. And I want us to be a safe place when it comes to public health. I want us to be a safe place where we respect each other. And we all know that there's a lot of work that needs to be done. But when it comes to COVID-19, the city will continue to work with neighbors, with churches, with businesses to help them understand how to stay safe and support Milwaukee families. I've been in constant communication with Commissioner Kowalik and her staff about their outlook and the plan for moving Milwaukee forward. Last week, we had concerns about some key indicators. And as we have said many times, we are continuing to follow the guidance that we received from the CDC, the guidance that the state has put forth, talking to public health experts, so that we can move back to normalcy. That is our goal. That is clearly our goal. But last week we had some concerns about some key indicators. In particular, we were concerned about test results and positive rates. This week, Commissioner Kowalik and her team reviewed testing data from the National Guard and health providers. Based on my conversations with the commissioner both yesterday and today, the commissioner is confident after review of the data this past week and today's updates that the criteria will be met and we can move to phase 3. So that is in many ways a major announcement. That means that as of tomorrow at 2 p.m., we are moving into phase 3 of the Moving Milwaukee Forward plan. The commissioner will issue the revised order tomorrow. You can expect to see more information about that. But I just want to run through some of the changes that are included in that. There will be guidance and requirements for summer programs serving youth. We will be increasing business capacity to 50% of occupancy with an absolute maximum of 250 people, increasing childcare capacity to 50%. Public and private gatherings will be allowed at 25% of capacity with an absolute maximum of 250 people. Bars and restaurants can open for indoor service at 25% of capacity. And I know that there have been a lot of bars and restaurants that are interested in that. So in the city of Milwaukee, as of tomorrow at 2 o'clock, bars and restaurants will be able to open for indoor service at 25% capacity. Outdoor dining will be allowed with precautions and basically the social distancing that we are all very familiar with at this point. And it can be expanded under the Active Streets for Business program that's been developed by our Public Works team and Business Improvement Districts. And I know Beth Weirick is on the phone and she's been very involved in that as well. So we want to make use of the outdoor areas. We think that that can really provide a benefit while at the same time doing a lot to make sure we're taking the public health precautions that are so necessary. Salons and barbershops, because of close contacts, will be kept at 25% 100% capacity with the one-to-one customer to staff ratio. So there's not a change there. All requirements about reducing contact for customers and employees, increasing cleaning and sanitation, and managing traffic will remain. The bad news is, of course, the disease is out there, and it is out there, and unfortunately, it remains very, very strong. Cases are still appearing. Hospitals still have not seen a major drop in COVID patients. We are counting on business owners to make smart decisions, and we'll be monitoring and responding to complaints appropriately. No one wants to see their business singled out as a hotspot. That's not good for business. It's obviously not good for public health. It's not good for individuals, but we are glad we're able to take a step forward. We do so cautiously because we know what history said about the 1918 flu pandemic, that people felt things were opened up too quickly in some parts of the country and the disease roared back. We're mindful of that. That's why we're taking this approach. I'm assuming some people will be happy with our decision. Other people will not be happy with our decision. But tomorrow the commissioner will give more information, and we're going to obviously continue to monitor this situation very, very much. So that's what I have to report on that front. And obviously we appreciate the interaction we've had with many, many business owners, with many employees who either want to go back to work or have concerns about their health and going back. And we've really tried to do everything we can to consider every one of those concerns. But mostly what we've done, and this was important for us, was to stick to the criteria so that based on the commissioner's belief that when we review the data today, that we will meet all 5 of the gated criteria tests, we're moving forward. So we're pleased with that. Again, I do so with some trepidation, simply because I don't want people to get sick, and we know what can happen if people congregate too much. I think right now with the weather, I think right now with the marches that are going on, there's a lot of people who feel like, well, we're over that. We're not over that. We're not over that by a long shot. And so we still have a lot of work to do. But with that, I'll turn it back to you.
Thank you, Mayor Barrett, for the update. And next we'll hear from County Executive Crowley.
Thank you, Catherine. Thank you, Mayor Barrett. As many of you know, we are definitely in some challenging times. We are definitely facing two pandemics right now. We had COVID-19, and racism is still facing us, and it's really come and created even more challenging tension within this community. And as I said on these calls and in public, I definitely stand with those who are making their voices heard. But we also must make sure that we're looking at these times and looking at this as a turning point to make sure that we're continuing to improve race relations and again, keeping on this path towards racial equity, not only just here in Milwaukee County, but across this country. And so I know that that's all I really want to say as far as the protest, but I also want to let folks know that if they are going to go out and continue to protest, it's extremely important as we talk about this COVID-19 briefing, that you protect yourselves. You do everything to continue to wear a mask, protect yourself, from this disease, and making sure you're protecting those around you. And so let's continue to show our support to folks, but also making sure we continue to thank our health officials that are on the front lines. As folks know, we still have the 2 national testing sites open at Custard Stadium and UMOS. Today, they are open from 11 a.m. to 7 p.m. And on Friday and Saturday, they'll be open from 11 a.m. to 5 p.m. and will be closed on Sunday. If I'm not mistaken, we'll be hearing from Mayor Brooks about the South Shore testing sites a little bit available. But also make sure that you continue to call 211 if you're feeling any types of symptoms to get tested, to get something scheduled. And so when we think about, coming back to work, Milwaukee County is working on a reopening plan, and we're going to reopen based off the science and the data. And so, we want to make sure that we're protecting everybody and that everything that we're doing aligns with those CDC recommendations that have been given to us. And so we'll have more details coming down the pipeline, but we are taking this process very seriously to make sure that we are protecting Milwaukee County employees and our customers, and just making sure that we are just doing our due diligence to keep folks safe. But I also do have some more, I guess, a teaser, if you will, when it comes down to some good news. We do have the Whitnall Beer Garden in Franklin, as well as the Milwaukee County Parks Traveling Beer Gardens reopening up next week. And so you'll see more additional details tomorrow, but I'm really excited to see some things coming online right now to provide that space for folks. And so as the mayor mentioned, there's going to be a lot of things happening clearly here in the city of Milwaukee when you think about bars and restaurants opening up, but also the outside dining areas. And so again, I just want to stress the importance of making sure that you wear a mask, practice social distancing, wash your hands to protect yourselves and those around you. We are all in this together, not just with the pandemic, but with racism as well. And so I want to appreciate everybody's opportunity to continue to have this conversation because it's extremely important that we're doing this, because clearly not only the pandemic, but what we've seen in the past few days has really exacerbated the reasons why we need to come together as a community. So with that, I will be quiet and pass it over to Dr. Weston.
Thank you, Mr. County Executive. Good afternoon. First, as always, to our numbers, we have 8,463 cases of COVID-19 in Milwaukee County and 288 individuals who have died. Today, we updated our dashboard with the latest key indicators for the county, all of which have remained stable since the Monday update. So they're all yellow, indicating cautious progress, except for testing, which remains red on our dashboard. We know that there are a substantial number of tests making their way through the state database process, so that number, the testing number, is expected to improve. We've also updated our dashboard with a few color overlays on the tables to better demonstrate the red, yellow, and green levels. So I think that should be helpful to understand where we're at as a community. On February 5th, so 4 months ago tomorrow, we had the first reported case of COVID-19 detected in Wisconsin. And certainly much has happened over the last 4 months. Back then, when looking at other communities around the world, as well as around our country, we saw how fast COVID-19 can spread and how severe the impact could be. We witnessed entire hospital systems pushed to their edge and beyond, at times with doctors forced to decide who gets a ventilator and who would not. In Wisconsin, and specifically Milwaukee County, though we saw thousands of cases and have suffered hundreds of deaths, we did not see the initially anticipated surge. This ability to maintain our healthcare capacity and provide for those in need was in part due to the preparation and plans put in place by our policymakers, our health systems, and our public health infrastructure. But it was mostly due to everyone in our community who made the personal sacrifice to stay home, to physically distance and not allow this virus to spread unchecked, as it would have if we all went about our lives as normal. So despite no surge, it's been a challenging 4 months. Challenging for small business owners, challenging for those with mental health concerns, for those who've lost their jobs, and certainly challenging for those who've lost loved ones to this disease. It's been particularly challenging to our communities of color that have been disproportionately affected by COVID-19 in each of those ways, much as they're disproportionately affected by other illnesses and diseases, as well as economic challenge. We know that historical, institutional, and ongoing disparities and racism negatively impact health outcomes, financial successes, and the ability to live a life free of fear. We see these concerns voiced on our streets and streets around the world each day in what has been overwhelmingly peaceful expression. We're 4 months in, and the next 4 months of this pandemic will likely bring more challenges and certainly more heartache. But for now, facing all of these mounting crises, I encourage you to step back and take a moment for empathy, for understanding, and for kindness. Many of us can never know what it's like to step into the shoes of those less fortunate and less privileged. But we can listen, we can learn, and ultimately we can act. Thank you and stay safe, and I will hand it back to Catherine.
Thank you, Dr. Weston. And now we'll hear from Director Roush.
Good afternoon, everyone. Hi, I'm Darren Roush with the City of Greenfield Health Department, and it's my pleasure to join today as one of the Suburban Health Department representatives in Milwaukee County. Today, as is the course every Thursday, I'm happy to provide data updates related to the COVID-19 Epidemiology Intelligence Unit that has been working with countywide data. And so I'll go ahead and share my screen, and we'll take a look at some of the key data that's already been mentioned by a few speakers here. As Dr. Weston mentioned, we have over 8,000 cases. This report is a couple days old because it takes a while to compile the data, and we have made some data tweaks that will help visualize the data a little bit better going forward. So when we look at case counts here in Figure 1, we're looking at the daily number of COVID-19 cases in Milwaukee County. We're now looking at it by specimen collection date, and previously we've been looking at that by laboratory report date. So this is a change in how we reviewed the data. We felt that the move to specimen collection date more closely aligned with the disease actually circulating in the community, because people generally have tests taken when they're having symptoms. So it's more reflective of what was happening in the community at that time. We also changed this figure to highlight the Milwaukee County suburbs separate from the city of Milwaukee. So you'll see here the yellow portion of the bars and the line is related to the city of Milwaukee. The blue bars and line are the suburban communities, the 18 suburban communities. So we see here generally we had upward trends to late May, and it looks now like we're heading downward. So downward trend is good and it's positive, and we're happy to see that, but obviously we're not out of the woods yet. Our 7-day rolling average is showing a downward trend in the city of Milwaukee, but we do know that there's still some data that's outstanding that may change that slightly. When we continue to look at Figure 2, here we're looking at deaths. Again, we have them separated out by county and county suburban communities and the city. And we're seeing, again, the same downward trend that we've seen for deaths for the last several weeks. Deaths in Milwaukee County related to COVID peaked in early April, and they have been generally on a downward trend since. When we compare our growth rate to the communities around us, we can see in this slide that in the top, we have in Milwaukee County a very long doubling rate of 34 days, which is very good, compared to 19 days in the WOW counties, Waukesha, Ozaukee, and Washington, and 21 days for the state as a whole. And we see that even clearer when we graph it out in Figure 4 here. The trend in doubling times is going down everywhere, but it's going down at a more rapid pace in both the county and the city of Milwaukee. Figures 5 and 6 look at our transmission rate, and again, we've separated out this data for the county overall, and then just looking at the city as well, and we see very similar trends. Very high rates of transmission were occurring in early March, and then we largely went quite low a couple weeks after the safer at home orders went in place. So the lowest transmission rate we've had in the history until very recently was in early April. We've hovered around 1 in the weeks and months since, and now we have taken a turn below 1 again, I think reflecting the decreased transmission and decreased number of cases we're having in our community. So again, something we want to watch, but we're certainly not out of the woods yet. We continue to track several demographics, and I highlighted last week that obviously we see that our younger population, the 18 to 39-year-olds, continue to have the most cases, and that's been something that we've been following for the last several weeks. Similarly, here in the lower left, we see that our Hispanic population within the last 3 weeks has surpassed the African American or Black population and has the greatest number of cases in our community. In this week's report, we have gone ahead and calculated population-based incidence rates for those populations. And so we can see while in the top here, while the 18 to 34-year-olds have the most cases, the incidence rate of COVID-19 is actually the highest amongst our oldest age group, which is 80 years plus. And this continues the narrative that we've mentioned several times in the past, that our oldest residents are at most risk of disease and its complications. And they also, and not surprisingly, have the highest rates of death and very high rates of hospitalizations as well. We see incidence rates in the next slide here. Incidence rates among the Hispanic population are over double that of the next closest population group's incidence rates. So the Hispanic population incidence is 20 per 1,000 residents. That's more than double the Black or African American rate of 9.5 and the Asian population rate of 9.2. So there continues to be a significant burden of disease in our Hispanic population that we monitor very, very closely. We have calculated the same sort of things in the full report as the media wants to find it, as well as posted to our Milwaukee County OEM dashboard page. Hospitalization data is broken out both cumulatively and by incidence, as well as death data. I want to scroll down and talk about testing because we've talked about this a lot in the last several weeks. We want to increase testing availability and tests completed. Unfortunately, I have to report today that the last 2 weeks of data is still backlogged. It's still backlogged in our system, and as such, weeks 10 and 11, as reflected on this graph, are still pending and not complete, so we have marked them as red and as pending. We continue to work on those, and we hope that we can get that resolved quickly. But with such an influx of cases, there's a lot of cases backed up in the system. The preponderance of those cases overwhelmingly is going to be negative cases, which drives that number of tests as we track it on these slides. And we're seeing a little bit better trending data. It's coming a little bit more flat as we look at percent positive tests. But again, not all of the data is in the system yet, and we need to continue to monitor that closely in the coming days and week. Lastly, I'll show you the spatial maps. I'll show you the cumulative map. This is COVID-19 new cases in Milwaukee County since March 11th. And again, very few spots of the county have not been impacted at a high level of COVID. And when we look specifically at COVID incidents or new cases within the last week, we continue to see a very strong clustering of cases in the south side of Milwaukee and the suburban communities in that area. So ultimately, what does this data tell us? Ultimately, this data tells us that COVID-19 continues in our community. While cases of disease appear to be decreasing, we need to continue to remain diligent about limiting the spread of disease through all of the methods we've talked about on this call. Staying safe, staying home as much as possible, limiting our trips to essential trips, wearing a face mask, and keeping a physical distance of 6 feet. It's all still important now as it was at the end of March when we were having higher rates of disease. Thank you very much and stay safe, Milwaukee County.
Thank you very much. Just a reminder, at this point, I do not have questions. If you have any questions that you'd like to ask our guests, feel free to chat them or let me know if you'd like to ask that of our guests. And our last guest we'll hear from is Beth Weirick. Well, Beth, you might still be up. You're on mute.
Thank you so much for allowing me to participate in this update today. First of all, I just want to express, of course, our saddened hearts over the unjust death of George Floyd. And I want to say that we stand with the community against institutional racism. And we will continue to be committed to creating a community that is just, that is fair, that is focused on tolerance, understanding, equity, and economic prosperity for all. I want to say thanks so much to the mayor for this reopening announcement today for tomorrow on phase 3. I know that so many of our businesses, our small businesses, their employees and their families have been struggling through this pandemic crisis, as well as the crisis overall that our country is facing. And I look forward to the phase 3 reopening, and I want to congratulate the Department of Public Works, the Health Department, the License Department, Department of Neighborhood Services for coming up with an innovative solution and your support of local businesses as we move into this next reopening phase. I want to say, first and foremost, we know our consumers still find it extraordinarily important to be in a space where they feel safe, where they feel that we are taking all precautions necessary. And I know that the guidelines that are provided in the active streets for reopening businesses are going to do just that. I also know our local businesses are very concerned about the safety and well-being of their employees and of their guests and their customers. What I like about the active streets as we move into this next phase where 25% of occupancy will be able to serve our guests, is that as the Common Council approves this resolution for active streets, which will happen on June 16th, you will have the opportunity to apply for a permit that will allow you to bring your dining outdoors into your sidewalks and possibly into some of your streets, these active streets. All the while, of course, exercising caution and paying particular attention to the safety and wellness of your employees and of our workforce. I know Milwaukee will set best practices. I know that we will provide a safe experience for our diners, and I know that our customers who come into our community will honor the rules of engagement as we move into this next phase. We'll honor the rules of social distancing. Please do this in order to be supportive of our local businesses. Allow them the opportunity to reopen with these safety guidelines. I'm grateful to the mayor and to the Department of Public Works. I'm grateful to the leadership of Alderwoman Mariana Dimitrievich for sponsoring this resolution, along with other aldermen on the Common Council and the Department of Public Works for passing this Active Streets for Businesses yesterday. I know the application isn't available yet, but my understanding is the guidelines are available at milwaukee.gov/DPW. I encourage our businesses to review those guidelines now, and let's get ready for a successful reopening. Let's get ready to show the world that Milwaukee is reopening for business and that we will do it with every consideration of safety for our employees and for all of our guests. Thank you so much.
Thank you, Beth. And I do apologize. We are also joined by the City of South Milwaukee Mayor Eric Brooks. So Eric, if you'd like to give us an update on the South Shore testing site, that would be excellent.
Yeah, thank you for having me. I appreciate it. And I appreciate the opportunity to talk about the testing site. I just briefly want to say that that's really good news to hear about Milwaukee moving to the next step. And County Executive Crowley, thank you so much I appreciate the beer garden comment too. We have one coming, I believe, in Grant Park in about a month. So I'm glad to hear that's moving forward too. So we, in the suburbs, right, we've been without orders now for over probably a couple of weeks. And I found that businesses and organizations are opening really responsibly here in South Milwaukee. And I'm confident they'll do the same in the city of Milwaukee as well. And I'm glad to see that the data seems to be trending well. I appreciate the report from Darren, and data is so important here. And I think it shows, honestly, I think the data clearly shows why we did what we did and had to do what we did. And I think we're moving, it seems to be in the right direction, but we do have a lot of work to do. I know there was a red stop sign, if you will, on the testing part. And I'm glad to report that the South Shore is going to be helping with that a bit. And in partnership with the National Guard, there's a South Shore COVID-19 testing site in action right now. It's today, tomorrow, and Saturday. Today and tomorrow, 11 a.m. to 7 p.m. on Saturday, 11 to 6. It's at the Cudahy Water Utility on South Lake Drive, right near Cudahy High School. And it's a partnership between the South Milwaukee St. Francis Department of Health, Oak Creek, and also Cudahy's Department of Health. And I believe it's the first one of this kind of collaboration with multiple suburban health departments to offer testing. So that was a hole, and I'm glad that we're able to fill that here. I think, there was not significant amount of testing available outside of the city of Milwaukee, especially in the south suburbs. So I'm glad we're able to partner together and really collaborate to get this done. And so again, the next 3 days, and it's 30 National Guard employees. It's really an all hands on deck approach. All 4 communities are also having their own workers staff this. It's really all hands on deck approach. I believe by the time this is done, you're going to have over 50 employees from those 4 communities also helping with this effort. So it's really vital as we move forward here in addressing COVID-19 in the suburbs, and certainly vital for the South Shore suburbs. We understand that, and I'm happy to provide this to residents. It's not just residents, it's open to everyone. No one will be turned away. It's free, and it's for symptomatic and asymptomatic individuals. So no appointments necessary. It's drive-through and walk-up testing both. So again, at the Cudahy Water Utility today, tomorrow, and Saturday, right near Cudahy High School. So that makes me happy as a mayor in one of those communities that we're able to offer this for folks. And, you know, I'll close with this. I mean, we're not out of the woods in COVID-19. In South Milwaukee now, I believe the number, we're about 120 cases in the city with another 19 probable cases. We've got a lot of work to do. We've been contact tracing from day one and doing a lot of work through our health department. We're hiring new contact tracers as we speak to continue that work and make sure that the data remains friendly and that the data continues in the right direction. So this testing will help. And we've already 177 tests administered by 2 p.m. So just in the first few hours, 177. So again, it's open, and we encourage folks to come down to the Cudahy Water Utility to take advantage of that. So thanks for having me today.
Thank you, Mayor Brooks, for sharing that additional information about the National Guard testing site. That is important. Just for reference, we also have Dan Boehm with Milwaukee County Transit System. If media has any questions regarding the recent announcement, he is available if you want to ask him a specific question. But first, we will start with a question from Tyler Eddy with TMJ4, and this is directed to the mayor. He asks, can you please clarify the capacity numbers for businesses and restaurants for phase 3? And he
I would be happy to. Again, the capacity is 25% for bars and restaurants with a maximum of 250. For salons, it remains at 25% one-to-one staff to customer ratio, and it's 50% for others. So again, to directly answer your question, 25% for bars and restaurants with a maximum of 250. Of course, all require safe business practice distancing. So that is not going away, and it will not go away.
Thank you, Mayor Barrett. Mary Spacuzza with the Milwaukee Journal-Sentinel has a question for Dr. Weston and Director Roush. Have you heard of any reports of protesters testing positive for COVID-19 or any clusters or outbreaks linked to the recent protests?
Yeah, so it's a good question. So typically we would expect at least a week usually until any sort of cases start showing up, often even 2 weeks. COVID-19 has a longer incubation period. That's the time where you can have the virus but not have symptoms. But toward the end of that, you can certainly still become contagious. And so we have not seen any cases at this point that I'm aware of specific to the protests, but certainly something we'll keep an eye on, and definitely a reminder that for those who are protesting, try to do so safely, wearing a mask, keeping distance from others, and staying outdoors. Thanks.
I also, if I may add to that, obviously those who are involved in the protest, please wear masks. Please do your social distancing. And if you feel that you have the symptoms, get tested as quickly as possible. We have the testing site at Custer Obama High School on the north side for people who are asymptomatic or symptomatic. And we've got the UMO site on the south side again for people who are asymptomatic or symptomatic. In addition to that, there are 15 community testing sites in the city alone for those individuals with symptoms. So if you have the symptoms and you want to go to one of those sites, call 211 for a location near you.
Thank you both for those resources and that information. Mayor Barrett, Jeremy Janine with Urban Milwaukee has a question for you. He asks, do you plan on joining any other marches again?
I was down at Humboldt Park March 2 days ago, and I do plan to be out there to support. I support having reforms in our criminal justice system. I support having better police-community relations. So I want to talk to people and see what they think we should be doing. So the answer is yes, I do.
Excellent. Well, with that, I don't see any more questions in the chat. So thank you all for joining us today. Thank you for the updates and information you shared. And we'll see you next week.
Thank you all.
Thank you.
Yeah.